Hello and welcome to the Supportive Care Services virtual Lunch and Learn series. We've created a series of Lunch and Learn videos to help you be successful when navigating your cancer journey. Our Supportive Care Services department is here to help you get actively involved in your healing process. For more information about the Supportive Care Services department, please email socialwork@ironwoodcrc.com.
Hi, good morning, and thank you for joining us for today's Ironwood Lunch and Learn. Today we have Jessica Wells, licensed clinical social worker, here at Ironwood, and she is going to go over a topic that we frequently have questions about, and it's one that Jessica and our other social worker here addresses commonly, and that is scan anxiety. So Jessica, thank you so much for joining us today, and why don't you kick us off?
Thank you. I'm so happy to be here. Scan anxiety, I think, is something that comes up with almost every single one of my patients, where it really kind of sometimes can thrust them into, for lack of a better word, just a downward spiral of intrusive thoughts related to, oh my gosh, what if the cancer comes back? What if the cancer progresses? What if? So today, hopefully, can provide you guys with some good tools and recommendations to help kind of quiet that voice whenever the anxiety gets high. I can't hear.
Sorry, still this technology. So we do have some questions here today, and the first one being, what are some physical ways that the anxiety can manifest when you're having that anxiety prior to your scan?
Yeah. The most common probably manifestation of anxiety is a stomach ache. The butterflies and the feeling in the stomach, or sometimes I always call it like the bubble guts, where you just feel like your stomach is unsettled. Sometimes it can manifest into tremors in the body. Sometimes even heart palpitations. A lot of times I have patients where they think they're having some type of heart-related episode or event, and it's really anxiety. A lot of times as well too, it can feel like a tightness in the chest. I've heard some patients describe it as feeling as though, a small child is sitting on their chest, or like someone's squeezing their heart. Sometimes it can manifest in that way as well too. Headaches, sweating, it really depends on the person, but those tend to be some of the more common.
Okay. Now, do you have any recommendations as to how they can help ease some of those anxiety symptoms?
Yeah, I think one of the ways to kind of help minimize the anxiety is to first understand how it manifests and presents in your life, because again, everybody's different. So being able to recognize when you're starting to experience the anxiety and what may possibly trigger it can be helpful. Sometimes taking a deep breaths are helpful. It sends signals to our brain to let us know to kind of relax, calm down. It can help to turn off our fight or flight response that kind of gets going when we become anxious. But one of the things with deep breathing too is trying to catch the anxiety early on. If you're in the middle of a full-blown panic attack, 9 out of 10 times doing deep breathing at that time is not going to be as effective for you. So I would say if you're going to utilize deep breathing, catching your anxiety earlier on, the first moment of feeling like that little tickle or feeling like, oh, I'm feeling a little unsettled, using it then. Deep breathing can be helpful. Guided imagery can be helpful. Guided meditation you can use. There's tons of meditation apps, Headspace, Calm. You can even go to YouTube and type in guided meditation for anxiety, and you'll be completely overwhelmed with the amount of videos that pop up that can help walk you through some of those. Sometimes doing some different CBT related activities that can kind of help you confront some of those cognitive distortions can be helpful as well. Journaling, writing down what you're anxious about. Those are just a few of the things.
Thank you. And, a good point that you made, I'm so glad you said it, is that when you're in the moment, it's really hard to focus on deep breathing. You're already in the midst of all the anxiety. So starting it, early on, great advice. Now, a lot of patients have caregivers also that want to know how they can help when their loved one is anxious. Do you have any tips on that?
The best tip I can offer is asking your loved one, how can I help support you in this moment? That I feel can work a lot better than, do you want water? Do you want this? 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 Because sometimes when you're right in the, the middle of anxiety, you may not necessarily know what you want. Maybe the thing that's going to ease your anxiety is the reassurance that your caregiver can't give you, right? And so I think, and everybody, feels support differently. So say, for example, Sierra, if you're somebody who, a hug is something that's helpful to you in the moment, and I'm giving you, I don't know, an iced coffee, that's not going to help. But if I say to you, how can I show up for you and support you right now in this moment? Then it gives you the ability to say, I could use a hug. Or it also gives the patient the ability to say, I don't know what I need. I need to be alone. I need you to stop asking me questions. I need you to just kind of let me be. And then definitely as a caregiver, sitting there with your loved one. It can be frustrating if you've offered something and they're not agreeable to it or don't want it, then try not to take it personal and just say, hey, you know what? I'm going to step away and give you some time. If you need me, I'm just in the other room. Let me know. I'll kind of check on you in a little bit. And then you can remove yourself from that.
Okay, great tips. Now, in any frustrating situation, sometimes we get the response from friends or loved ones or caregivers, oh, just stop worrying about it. It'll be okay. How do you think that patients who are really worked up and, are feeling anxiety over their scan, how should they respond to those people who are, making comments such as those?
Oh, it's so hard. I feel like so many patients here that like, oh, stop worrying about it. If it were that easy, nobody would be worrying about it, right? Nobody would be anxious. It's almost like telling somebody when they're angry to relax. It's the equivalent of that. So I think as a patient, it's always okay to let those around you know how to show up for you, how they can best support you, how they can best love you. And so maybe that's saying to them, this would be more meaningful to me. This would be more helpful to me. It's not helpful to be told to stop worrying because I don't want to be worried. I don't want to have anxiety. I don't want to feel the way that I'm feeling. So being honest and transparent with your loved ones to say, that is not helpful to me. I can understand you want to help. This is a better way to help. Or I don't know what I need. I know that that's just not helpful. Can you give me some time? Don't be afraid to communicate that. And I will share, with caregivers and loved ones, please be cautious of those types of, oh, just don't worry about it. Because what in turn happens is the patient then puts additional pressure on themselves to be okay, to be fine, so that you don't worry. And sometimes the, oh, just stop worrying about it. It'll be fine comes across as though your feelings are making me uncomfortable. I don't want to be uncomfortable. So I need you to get it together so I can be okay over here. And again, I don't think that's anybody's intent, but that's how it can come across sometimes.
Yeah, definitely. Now, let's see. So before a scan, you're obviously maybe wanting to do the things that, relax you a little more than normal. So what are some things that you should avoid as a patient who's getting ready to have a scan and they're already anxious?
I definitely maybe would avoid Googling. Don't, take to Google and start, oh my gosh, what if blah, 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 blah. You always end up like 150 pages deep down some rabbit hole, looking up some rare disease that you now think you have in addition to cancer. That's just the nature of the beast.
Mm-hmm.
Don't Google. I would also say don't be afraid to say that you're anxious. It's okay to say, I'm really worried about this scan. I'm really scared that the results may not be what I want it to be. I would also maybe too, depending on the level of anxiety, maybe try to avoid some heavily caffeinated drinks, because sometimes that can make you jittery and make your heart race as well too. So maybe kind of avoid those types of things.
Okay. Do you have any recommendations on specific meditations or breathing exercises that our patients can use in the future?
So there's the 4-7-8 breathing. With that, you're taking a deep breath in through your nose for 4. You're going to hold it for 7, and then you're going to breathe out for 8. And so you want to make sure that when you take the deep breath, it's a, and when you breathe out, it's a, you want to hear the breath come out. Doing that a few times, again, as I said previously, will send signals to your brain, letting your brain know, hey, you're safe. You don't have to, because, again, our body goes to, oh my gosh, it's a bear. Do I fight from the bear, run from the bear? Doing the deep breathing lets you know, hey, there's no bear. You're okay. You're safe. And again, if you can't remember the counting, I always say it's less about the counting and more about just taking those deep soul cleansing breaths, the in through the nose, out through the mouth. That's what makes the difference. I would also say as well, there's a mindfulness exercise called the 5 senses, and it helps to bring your focus to the present. And you just run through your senses of, 5 things that you can see around you, 4 things that you can hear, 3 things that you can feel, 2 things you can smell, 1 thing you can taste. Again, don't get caught up on the 5, 4, 3, 2, 1. If you do them out of order, that's okay too. It's more about just doing something to bring your attention and focus back to the present. Something else that's super simple, sometimes just wiggling your toes. It brings your focus to the fact of the sensation that you're feeling in your toes, and you can focus on that. What does it feel like to have your toes wiggling? Where do you feel that? Again, something very simple, mindfulness-based, that brings your attention and focus to the present, because a lot of times anxiety is the result of us thinking too far in the future. What's coming next? When's the shoe going to drop? What's this? What's this? What's this? We're telling ourselves stories in our head that cause our anxiety, bringing us back to the focus to say, okay, wait, nope, I'm here in the present, can be helpful.
Okay, great. Yeah, those are helpful tips. And not only when we're having anxiety in your scans, but just every day making it a practice. So Great advice. All right. Well, thank you so much. Do you have anything additional that you'd like to add?
No, that's it. I would say as well, don't be afraid to share with your medical professional if you feel like your anxiety is so severe that you may need a little bit extra. There's no harm in that. As a social worker here at Ironwood, I do offer individual counseling to work with patients specifically on any anti-anxiety techniques and coping skills that they might need to help support them along their cancer journey. So just know that you're not alone. You have an advocate here in us, in the supportive care services at Ironwood, and we're more than happy to assist however we can.
Great. Thank you so much, Jessica. And thank you to everybody for joining us today for our Lunch and Learn. If you guys would like to view any of our our previous Lunch and Learns, please visit our website at ironwoodcrc.com. Up in the top of the page is a YouTube icon, and all of our previous content, as well as this video, will be there. Thank you so much, and take care.
Thank you for joining us. For our virtual Lunch and Learn series, we hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services classes and events, email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.